Hello, everyone. Good afternoon. Thank you for joining us again for this amazing session. My name is Rama Issa-Ibrahim, and I am the Deputy Public Advocate for Justice, Health, Equity, and Safety. I know earlier this morning we had a real deep conversation about health equity. Now we're really going to focus on safety, and we have an amazing panel today. As so many of you know, the public advocate has been a big champion of police reform and accountability and has always been looking to find different systems that can address harm. And so today we're going to be talking a little bit more about different alternatives to policing and really highlighting the work that many folks on the ground has done over years and decades. And I will introduce, without any further ado, our moderator for today. Since we're running a little bit behind, Monifa Bandelli is a Chief Operating Officer at Time's Up, where she oversees the day-to-day operations and ensures the organization is set up to deliver on its global strategic goals to ensure safe, fair, and dignified workplaces for women. In addition, she sits on the policy table leadership for the Movement for Black Lives and the Steering Committee for Communities United for Police Reform. Bandelli has more than 2 decades of advocacy and policy experience, such as launching 2 historic and successful legal cases against police misconduct in New York City. I believe most of you know Floyd versus NYC. And then working to pass 5 landmark pieces of police reform legislation in New York. And prior to Time's Up, Monifa served as a Senior Vice President and Chief Equity and Partnership Officer at Moms Rising, co-leading a national on-the-ground and online grassroots organization of more than 1 million people working to achieve economic security and justice for moms, women, and families. She also worked at the Brennan Center for Justice, leading a successful coalition to restore the right to vote for more than 250,000 formerly incarcerated people in 5 states. I mean, this is an amazing resume. Thank you so much for being with us here today, Monifa. I'll pass it all out to you.
Thank you, Rama. You make me sound so good. I'm going to have to take you to all of my family gatherings because that you made me sound very impressive. But actually, I'm very humbled to be here with this amazing panel. When we ask the question, what keeps us safe? This is what safety looks like. The folks who are going to be joining this panel are people who've been on the front lines for keeping our communities safe and for modeling the system that we know bring health and equity and most of all, safety. So I'm going to start with introducing our partners from Make the Road New York. Adilka Pimentel is a Black Latinx organizer who was born in the Dominican Republic, raised here in the United States, and grew up in my hometown, Brooklyn. Adilka is the lead organizer at Make the Road New York. And every time we see ourselves on the front lines pushing for change, you know that Adilka is there. She does Know Your Rights sessions, Cop Watch, leadership development, and participates in the many coalitions that are pushing for the moment that we have today. So welcome her to the stage. Also from Make the Road, we have Keith Fuller. He is a core leader of the Youth Power Project at Make the Road. He's a graduate of the Bushwick School of Social Justice and attends York College. And for the last 8 years, Keith has organized to increase police accountability and transparency to remove police from schools and implement restorative justice practices. We know that is a key lever in our safety, imagination, and dreams. Our next partners we want to bring to the stage is the Drug Policy Alliance. We can't say enough at how drug policies have fueled mass criminalization and mass incarceration. And so we have Melissa Moore there. She works at the Drug Policy Alliance, which centers on shifting New York's approach to drug policy and repairing the harms that the war on drugs has caused to individuals and communities, particularly through her work leading Start Smart. And she's going to share more about that. Also to the stage, we're bringing the Freedom Agenda, where we have Peggy Herrera. Central to all of our work must be the leadership and the expertise of people who are directly impacted by incarceration. And so Peggy Herrera is an advocate for mental health treatment and leader at Freedom Agenda. And the Freedom Agenda is a member-led project dedicated to organizing communities directly impacted by incarceration. And she'll talk more about her work. And then the last two panelists, we have the Restorative Justice Initiative with Anuj Bandari. Anuj is an artist and community organizer focusing on shifting dynamics of harm and healing with an eye towards restorative and transformative justice. Anuj previously worked as the RJ coordinator at Make the Road, one of my favorite organizations, and is currently the network coordinator for Restorative Justice Initiative in New York City. Last but not least, someone whose work I've admired for a very long time, we have Reverend Dr. Divine Pryor from the Community Capacity Development. He is currently the Senior Policy Advisor at Community Capacity Development and the founder and executive director of People's Police Academy. For over 30 years, Dr. Pryor has dedicated his career to police reform, dismantling the punitive justice system, and rehabilitating the justice system internationally. First, as the first formerly incarcerated person to have graduated from the New York City Police Academy, he's also co-founded and directed the Center for New Leadership on Urban Solutions. Thank you, everyone. Welcome to this. I said it was fire. That was fire. We have every corner of our work. We have all of the building blocks that keep us safe. And so we're going to dive right in and talk about what we need to implement moving forward. So we're actually going to start with you, Dr. Pryor. You are one of many who are part of the thinking that went into creating and implementing what is now the Crisis Management Center. Can you tell us about your work as a violence interrupter and how we can better expand CMS, cure violence to address the uptick in gun violence, and to do it from a more community-oriented space? And when you answer that, also talk to us about what level of funding is needed to create a true impact. Because we're going to talk about invest, divest, right? So how much is needed? What is it? How much is needed? And we know where we can get the money from. But Dr. Pryor? Your mic is muted. So just unmute your mic real quick first.
Thank you so much, Sister Bandelli. It's an honor to be amongst this extraordinary group. I know of the work of, if not most, all of the groups here today, and I know that I'm in the right company. Let me start with the last part fast. We need a lot more. Right now, the crisis management system is operating somewhere around a $50 million budget, which is a drop in the bucket when you compare that to the fact that the work that they do is attempting to be parallel with the work being done by the NYPD, whose budget, is $2 billion plus. So that's a whole nother conversation. And we'll talk about that when we talk about defunding, because there's probably a misunderstanding about what that means and what it doesn't mean. So I would really like us to get some clarity on that. I've been involved in this work, for 30 years. And over that 30 years, I've seen a lot happen. But the one thing that I'm most proud of is that individuals who are most directly impacted by the criminal, what we refer to as injustice system, are the ones who have rose out of the ashes, and they are the byproducts of 50 years of the war on Black folks and people of color, the war on crime, the war on drugs, the war on poverty, the war on just one war after the other, and we've somehow been able to survive and innovate and improvise. And I think we've come to an understanding that those of us who've gone through the fire are the ones who are now qualified to begin to start going to put the fire out. And I think that when we talk about the crisis management system, we're talking about using individuals who were formerly incarcerated, people who belong to street organizations, individuals who were part of the underground culture, who understand how to get out. I mean, it reminds me of a story of a person who was stuck down inside a hole. They had fallen in the desert. And every now and then someone would walk by and they would ask for help, and the person would say, okay, let me go get a rope. The next person would say, let me go get a ladder. Another person said, let me get some help. And then the last person that came when was asked for help, told the person, well, stand back. And the person stood back and the person jumped down in the hole. And he said, oh my goodness, I'm stuck down in this hole. I'm trying to get out. Why would you jump in the hole? He says, oh, because I had to come down in order to show you how to get up, you know? And that's what the crisis management system has done. It has assembled an extraordinary assortment of women and men who have gone through the fire, who are qualified, who have the skill sets, who have the insight, but most importantly, have the credibility to actually go back into the community and talk the talk, you know, and they talk the walk. And these are individuals who, when the house is on fire, they're not running out, but they're running in, because they understand that there are lives that have to be saved, and they understand that it takes bravery and courage for you to be able to go to places where a whole lot of folks can't go. And this is no knock against the professional disciplines, because I love all the disciplines. But let's face it, there's some places that some people can go and some places other folks wouldn't dare go, right? And we need to know our lane. We need to know our place. The credible messenger system has really organized and prioritized and categorized the skill sets, the needs, the abilities of individuals who can go back. Let me say this and I'll stop, because I know we only have a little bit of time and it goes real deep. But what I can say is that I think it's time that we take back control of our communities. I think that we've allowed things to get out of control. And I think that we have the ability to realign our communities. And I know we can do this in a real way. The work that I'm doing now at the People's Police Academy, a lot of folks is not aware, but it's really about community control. It's about community organizing. It's about reducing the footprint of law enforcement in our community. And it's about clarifying the fact that public safety and law enforcement is not the same thing. They're not even two sides of the same coin. Public safety is about us. It's about community organizing. It's about community mobilizing. It's about community control. It's about us harnessing our resources. It's about us looking out for each other's affairs. It's about each one teaching one. It's about us caring about our personalities, our properties, and looking out for the best interest of us. That's what that's. But law enforcement is after the fact. Right. Law enforcement is intervention. We're into prevention, you know. So we want to have this conversation so that the community understands we need you to step up, because we actually have a major responsibility and what it requires to keep our community safe. I'll stop there, and because I know we have limited time, and perhaps if I get another shot, I can add some other pieces in. Thank you so much.
Yeah, absolutely. And, you know, I'm going to go to Adilka and Keith to talk about what's happening inside of our schools. But just as we go to them next, you know, when I want to come back to you after that to really ask you two specific questions about, from your experience, how can New York City improve the mental health crisis response, and what you think of the mayor's pilot programs. I'm going to come back to you after we deal with the school piece, because we need some direction there, right? We need to know what it is we need to fight for and what we need to scrutinize a little deeper. So Keith, most of us haven't been inside a public school in a very long time. Whoever put that in my notes, I don't know, they're trying to age me, but it's actually true. Can you paint a picture for us about what entering and being inside a school building is like for 8 hours? We've been engaged in this conversation about safety inside our schools and how much youth need to be a part of that process. For you, what does a safe school look like, and how do we get there?
Yes, I can. I would say it first depends on what type of financial status your family holds, which will often correlate to the neighborhood of your school and the amount of resources and opportunities you'll have. And so for me, I grew up in a family that lived on a paycheck-to-paycheck basis, and I ended up going to my local high school, not because it met my educational needs, but because it was affordable and close by. So the typical day for me was waiting in line, leading outside the building with anywhere between 10 to 30 of the students standing by to be processed. And like during this time, you better hope it's summer, otherwise you're waiting in the rain, snow, and often near freezing temperatures. So throughout this period of waiting outside, you're told to remove anything metal related. Then you put everything into a security scanner, something you'd see out of an airport, really, and move over and hopefully only have to pass through the metal detector once and avoid being pat down. And I say hopefully because now you're either being aggressively patted down or either asked to remove sneakers or boots and paraded around, essentially, often leading to ridicule from both your peers and often school safety agents and or school resource officers, or whatever you want to call them.
Right.
Also, depending on the weather, you better get accustomed to either bringing an extra pair of socks or enjoying or enjoy having wet feet throughout the rest of the day. You're then sent to class. First two periods go by. You head to lunch. From there, you're faced with realistically two choices. Either you starve yourself because the food is there on the best days, or you take what you can and hope it holds you over for the rest of the day. Lunch finishes, everyone stands up in unison, and you're essentially herded like a flock of sheep and end up hurrying or running through the exit so that you're not late to your next class.
Right.
You continue to go throughout your day, trying the best you can to learn, and not all students are on the same level of comprehension. Some are far ahead and others are far behind. And there's very few avenues to address that. Being in a school where there's only one guidance counselor per 100 or so students. And in my case, that ratio between counselor and students is actually on the better end of the spectrum. I know all around New York City, it's somewhere between 1 to 350 or so students.
Wow.
Now, all of that is hoping that the day goes by good and you're able to avoid any forced contact or interaction with the school safety agents or SROs, because there's at least 2 on every floor and even more when you're at lunch. And dismissal is probably the most chaotic thing you'll ever see because you'll have groups of SSAs like located throughout different spots of the courtyard, and they're essentially used to push away students from the building, both figuratively and literally, often towards areas where you now have uniformed police officers, and we can turn on any screen and see how well de-escalation has worked with both parties.
Right.
So that's the run of the day.
That picture is so what I have seen. You know, I haven't been in recently as a student, but I went recently to give a workshop maybe about 2 years ago at a high school. And as I was processing in the front, I saw the students, you know, having to show their ID, go through the process with the school safety police officers. And one went by without showing the ID. And the officer yelled, "B word, you heard me," you know, and it was just so jarring that then when I went to give my presentation, I was still shooken up, you know, by that encounter. So I can only imagine, how can students go to class? Like, how can you then go and take a test, you know, after that kind of interaction? How can you give your book report or do your presentation? Because even as a grown woman, I was trembling to then give the presentation because I was so jarred by this police officer cursing at a child entering their school building. So thank you for that picture. And it just makes me ask Adilka, what are the systems? What are the mechanisms? What do we put in place to get rid of that and to actually put safety and health in there?
I would.
No, yeah, go ahead, Keith.
I would also. Yeah, because you mentioned I didn't really address the second part of the question, which was like, what does a safe school look like? And for me, I say the first step to making a school safe is to first make it supportive. Time and time again, you go to school and you feel like you're just there because you'd be in serious trouble otherwise. And that's not how you keep someone engaged. That's not how you prepare a young person for their future. That's exactly how you lose people. And in this case, we're losing many of our Black and brown students to the criminal justice system, or as it was appropriately called, the criminal injustice system earlier. So when you ask me, what does it look like for our schools to be safe? And I say first must be supportive. The kind of support that we're looking for is funding so that our schools have enough resources and can focus on hiring more social workers, guidance counselors, restorative justice coordinators, and many other educational and physical and emotional needs in schools where Black and brown students have faced heavy criminalization. And you ask, how do we get there? We get there by actually creating a budget that prioritizes the needs of our students. And what our students don't need is $450 million allocated to the school safety division. We can build a pathway to safe schools, and I'm telling you, we can start by reinvesting that aforementioned $450 million in the school safety division budget to all other things that we know our students are lacking and have been deprived of. And I can pass it on to Adi to say more.
Yeah, and I'll be brief because I know we're also pressed for time, but thank you, Keith, so much for that. I also haven't been in school in a long time, so I was taken aback as someone who often waited outside in the cold and often had to take off my Timberland boots to be scanned. So thank you for that. In conjunction to what Keith mentioned, with budgeting and education and resources, young people have been calling for decades. I've been almost 20 years for me, calling for removal of police from schools. And that's a full and entire removal. New York City has around 5,500 school safety agents, which not only make it the sixth largest police force in the country, really proves to where, if a budget is a moral document, where the city is really thinking our money should be invested in. And so on top of removing the police from schools, it's really doing what has already been mentioned, reinvesting into our communities, into our schools. We're living through multiple pandemics right now, COVID-19 and police terror. And we know now more than ever is a chance to really switch up and change the culture of what schools are like, where they criminalize youthful behavior and really criminalize young people for being young. And there are a lot of young people like myself who were undocumented our whole time in high school. And so having so many police officers present really heightens the ability or the chance of you having an interaction. And then ending up, like was mentioned again, right, in the very unforgiving criminal justice system or the deportation proceedings. And so, I know we're going to get a little bit into restorative justice in a bit, but but really centering that for sure. And the directly impacted folks are the ones who have solutions. We have 1 million students in New York City who are not centered and who are not valued. And that also needs to shift completely and radically. And it's not a radical thing to ask for, to center young people and their lived experiences. But, they're calling for this and honoring that and listening. And it's really not just New York. New York we've actually fallen behind in the nationwide call for police-free schools. But the young people are out here and hustling and living these experiences. A lot of us have lived this and are calling for that removal.
Absolutely. I mean, not only is it not radical to ask to censure students in a school, it's what happens to many other students. They just don't happen to be Black and brown students. They don't happen to be in our community. But I can't count, the number of schools I've seen or heard of that are child-centered, student-centered, but it's never the ones that the young people in our community have access to. And so there's a question from the website about Union Chief Greg Floyd has continued to claim that SSA doesn't harass young people in schools. How do you respond to that denial of misconduct? And then there's another question that is also in the same thread, still on this topic. Can he specify what school he's speaking of? Oh, let's just answer the first one then. Do you have a response? Have you guys been collecting stories or data?
So I have a response, and then other folks can jump in. My initial response is I am a product and a graduate of New York City public schools. That my school had school safety agents, and I myself have been sexually harassed by a school safety agent. I know many young women who I grew up with and who I have grown to support and love through working and organizing, who have gone through the same things. And it's now where I would say we believe the students. You believe the young women and the gender nonconforming folks and the young men who have ever felt uncomfortable or harassed by school safety agents. That's my response. We believe these students and we support them and into that healing center. And just really reiterate the need to remove police from schools and replace them with restorative justice practitioners and guidance counselors and social workers who not only get to the root cause of what's going on, provide that safe space that doesn't exist right now for anyone who is going through something with school safety agents to then go and do that. So these folks who one look like us, that's the hope, but also are trained to do this and will, stand up for folks who are saying essentially survivors, really create that safe space that is not created now and shouldn't fall into the hands of the NYPD. We want to take away the scope and the hands and the places that they're in. And I can tell you the only reason I felt safe enough to keep going to school was never because of a school safety agent. It was the relationships with the teachers and the organization that I work with that I built. And essentially I can say that's the majority of young people that I've met who go to these schools.
Thank you so much for addressing that. And I want to underscore that I even said at the top of these questions, I witnessed abuse, firsthand, just recently in the school, verbal abuse, not 5 minutes in the door of a public school. So I hope that answers that person's question. But you mentioned restorative justice. And so I want to pivot over to Anuj to talk about what is that? What is restorative justice? What are the components? How is that going to bring us safety?
Awesome. So it's, I feel like the further and further I get into restorative justice as community practice, like the words I use to try to like hold it just never seem to suffice. So I'll throw that out at first, that it's like so many things. I want to center it as an Indigenous practice of community togetherness and really understanding how we take care of and respond to one another in our everyday lives. And I think like one of the things that I think a lot about is like restorative justice as it plays out in institutions, and on an institutional level, what it's most often referred to as is an alternative to punitive discipline, right? And so just in this start, like I've described it as these two things, like a community practice of togetherness and a response or an alternative response to punitive discipline. I think it is both of those things and so much more. But I think first and foremost, what restorative justice really means to me is that if you do not have community and community care at the foundation of how people are treating one another and in community with one another on an everyday basis, your functionings of how you respond to harm probably aren't set up to like heal in any way, right? And so I think it's interesting, like there's a lot of conversation about like the implementation of restorative justice as response to harm, as the first step. And to that, what I have to say is like, we're missing this really big opportunity to actually think a little bit more critically about, well, how do we see any community space that we're in as a space, as a chance where belonging can be built, where your authentic self can be brought. Right. I worked for a few years as a restorative justice coordinator in schools. And one of the really big things that would always come up in the response to harm context is like, well, this isn't working. Like we always had like teachers and staff and administrators in examples say like, well, this right now isn't working. And really the question that I would always have in response is like, well, have you asked like this young person how they are before? Like, was the first time you heard about their lives sitting in circle with them after a harmful incident happened, right? And so really wanting to center restorative justice as like this community-based practice of just how we are curious together, how we question, ask together, how we build intimacy together, and how we understand how to respond to harm through that intimacy, right? Like at the end of the day, you are going to respond differently to somebody you love if they do something hurtful than a complete stranger, right? And a lot of what restorative justice says is like, well, how do we open up the ability to understand how we can respond to harm by seeing that potential, the potential of understanding, holding space for that humanity in anybody around us. And I know another thing that comes up around restorative justice is that question of like how we know it's working. Right. And I think there's like a few ways. I think one is thinking about like, well, are in like the school instance, like are youth spending less time being pushed out of schools? Are there less days being used on suspension? But I'll also say that like a lowering in conflict is not the primary. It is an important metric of restorative justice, but it's not the primary metric. Because what restorative justice is, it's not the absence of violence, it's the transformation of it. And so really the how are we doing is how are we as a community responding better and better and better to moments where harm occurs? How are we responding to harm with the lens of transformation, with the lens of, I know what you did has hurt people, and we can hold space for the transformation of that hurt. Yeah. And that requires a lot of changing the questions of like, who did what to like, really what is being experienced here. So, yeah.
Yeah, absolutely. How we repair, and how we restore ourselves versus the punishment, which then perpetuates the violence, right? It pushes it forward. And this is a model, and this is a framework and a praxis that works in schools, but also to the larger, there's a school to prison pipeline, but the larger criminal justice system, right? And so I want to go to Peggy because, we know that our folks who have experienced firsthand mass criminalization, mass incarceration, have put out tools to both close pretrial detention, which she has led the fight for, but also what are the alternatives? How are we promoting things like restorative justice initiatives in the larger sense, coming out of a school model or a similar model to what Anuj talked about in schools. So Peggy, can you talk about this fight to end pretrial detention? It's a hot one, touch on it. Let us know where we are in it. What are some of these models that we will put in place that actually will heal instead of perpetuating violence? You unmute yourself for it. Yep.
Okay, so the question is, what are some of the models that we'll use instead of mass incarceration? First of all, I really, really want to say that the most important thing we need to do is divest from the law enforcement. There's too many law enforcement agencies, NYPD, the DAs, they have like a $15 billion budget, right? So what if we divested from that and took it and put it into jobs and housing and education, and cure violence programs? There's so many things. Like, this is such a broad question because what we're doing now is obviously not working.
This is what's not working, right?
It's not working. This is not working. They have all the money and you continually give more money to them. And what you do is you offer our very own people the benefits. You offer them, these jobs that actually create more harm in our own communities. So our own people actually harm our own people. So we need to do better in how we respond to just in everything. We need to invest. When you define, I try to think of defining public safety. So public safety is jobs. Public safety is investments. Public safety is mental health resources. Public health is drug addiction programs. It means divesting from mass incarceration and keeping our families together and stop incarcerating our fathers, and giving our communities what it needs. You can't define public safety any other way but to say, give us what we need so that we can flourish. Be fair across the board. Stop throwing us crumbs. Okay, it's enough. We don't want no more crumbs. Every year they give us a little bit of something. Here, you can have that. And we write these bills like, okay, let's just write this because if we ask for all of this, they're not going to really give it to us. So let's just kind of settle. No, we're going to demand and we're going to ask that you give us what's rightfully ours so that as a community, we can flourish just like you do. Right. So, that's a really big stand that I take on that. The NYPD has a balloon budget. Their budget is just too much. And DOC, they're like 2 for every person that's incarcerated, which makes no sense. Get rid of them. Get rid of them. They don't need to be there. We don't need them. So that's my take on, things we need to do to replace the way they do what they're doing now.
Absolutely. And when you say a balloon budget, you mean with a B, because it's in the billions, right?
Yes.
And you take NYPD, $6 billion, you add DOC on top of that, you add a whole another couple billion. It is unheard of. And it's a value statement. That's like the moral compass. That is where the money goes. And that means that is what the government and the city as a whole believes in. And we want to shift that to all of the things that you listed. And so thank you for your work. Thank you especially for your work in ending and shrinking pretrial detention. One of the things that I think about right away that has been used as a pretext to mass criminalization and mass incarceration has been drugs, right? Dr. Pryor talked about the war on drugs and the war on this and the war on that. And we have been, getting more and more. There's been so much more information out there. There's a documentary that's out now called Crack, that I think is blowing people away when you talk about the war on drugs. Some of the stories of like our heroes. I don't know how many people watch the Billie Holiday narrative. The sister who starred in it just won a Golden Globes, but people were shocked to know that drugs were used as a pretext to criminalize Billie Holiday. right? So people in our community, our political icons, our cultural icons, it's almost like a tool that you can use to just stop and to disrupt everything good that we got going, right? All of the safety. She was a champion for safety because here she was working against lynchings, right? And the drug policies were used to not only incarcerate her, but ultimately, prematurely end her life. So I want to turn it over to Melissa to talk about what is the now, like knowing that what we've seen on that crack doc, for those who've watched Billie Holiday's story, where can we go right now to stop that narrative?
Thank you so much, Monifa. And I think that's a crucial point that you're raising, and something that we've seen from the Drug Policy Alliance perspective just over and over again in our work in New York, for decades now, and going back even well before that to the period that you're talking about, way back with Billie Holiday and back in the 20s when prohibition was first instituted in New York. It wasn't about the substance. It wasn't about anything having to do with the science or the pharmacology. It was straight up being used as a tool to attack, to target, to criminalize communities of color in New York, full stop. That's what the drug war has always been about, time and time again. And we see that, in our work in New York, looking at, just decades of over-policing, of absolute racial disparities up close in the work around the marijuana arrest crusade. And, we've watched as policing has played such a pivotal role in the racist drug war, in how it's played out, just on the ground in New York, how resources have been funneled away from communities and into law enforcement, away from vital services that actually make communities safer, and into precisely the tools and precisely the entities that criminalize communities, that tear down communities, that break folks apart, that rip apart families, instead of actually investing in the types of policies that are going to be life affirming, that are going to be holistically building community well-being. And so when we're looking at the drug war and the way that it's been an excuse to target, to harass, to assault, and to kill Black and Latinx New Yorkers in particular, even at the start of the pandemic, at the beginning of shelter in place, when everybody was told, avoid contact no matter what, we still saw NYPD making arrests for low-level marijuana possession, tackling people in the subway, and with officers not wearing any masks whatsoever, tackling New Yorkers in the street, young people of color, beating them down in parks. One of the first virtual rallies that we held was off of when NYPD officers swooped in and beat absolutely mercilessly a young man in Brooklyn. And so as long as this is on the books, as long as marijuana legalization has not passed, as long as we have not reformed our other drug policies, it continues to be, as you were saying, the catch-all excuse that's used time and time again to target. And so as we're talking about flipping the page, and I do want to turn to the conversation about where do we go from here, because what we're seeing is unacceptable, and we're not going to stand for it anymore. And that's part of the Start Smart campaign around marijuana justice. That's part of the broader work to reform the drug policies across New York State as well, and get syringe decriminalization, get, moving to a place where we're going to take our entire approach to drugs out of the criminal legal system. But as we're getting to that place, restitution is owed also. It's not enough to simply turn the page and to have the powers that be, elected officials, the governor, other people acknowledging harms, using the talking points, but not actually building in the policies that are going to repair those harms and actually provide restitution for the people in the communities that have felt that have lived that have been torn apart over it and have been devastated by it. So what we're talking about with the marijuana justice campaign in particular right now, and what's on the table from the legislature's position with the Marijuana Regulation and Taxation Act, is very clear about what's owed in terms of expungement and actually addressing fully and comprehensively all of the other harms that just continue to cause lifelong consequences for people, for child welfare, for housing, for employment, for immigration purposes. It's having no new penalties as we're moving forward in legalization, not putting all sorts of other things baked into the back end that's going to continue to be the catch-all, that's going to continue to be the stop and frisk 2.0 that we still see with the odor of marijuana being used all the time to come after people. And it's making sure that there's equity in how we're building the industry, as well as actual community investment, that the money that's going to come in off of the backs of everybody that's been criminalized that got to this point, that have been fighting to undo the racist marijuana policies in New York, that the money is actually going to go back into those very same communities, and that there's going to be opportunities for people to build generational wealth to be able to move forward out of this hole that we've dug ourselves into.
I love it, because every time I hear DPA talk, especially my beloved Cassandra, my homie, I think of that quote by Malcolm X, right? He's always saying, if you plunge a knife 6 inches in my back and you pull it out 3 inches, that's not progress. If you pull it all the way out and I'm just bleeding, that is not progress, right? You have got to stitch it up. You've got to heal the wound. You've got to make sure, the time that I spent missing work because I was stabbed in the back, that I get compensated for that. I mean, all the things. Of course, he put it more succinctly and eloquently than that, but we've been talking about this for decades, that progress isn't just stopping something. And a lot of states are moving fast and say, oh, these laws are bad. Okay, so we'll just stop those. It's like, no, you've dropped an entire bomb on entire communities for generations. And there has to be repair. There has to be reparation for that. There has to be healing for that. So thank you for that perspective and always driving that home. And like Peggy kept saying, like not compromising that down. You know what I'm saying? Like not going in and say, well, at least no one tomorrow will suffer what we already got people in prison right now suffering for. So I appreciate that. We've got just less than 10 minutes left. I think we have like exactly 7 minutes left. And so I really want to do it in this order. I would love for Dr. Pryor to talk about that mental health crisis center and your thoughts on the proposal from the mayor. And in short, and then I want to go, because Peggy gave us such a clear call to action about what it is that we need to prioritize and what we need to deprioritize. And I want to go to Keith and have him build off of that and end with a call to action from our youth. So, Dr. Pryor, can you talk about this proposal? And, is it good? Is it bad? Is it fall short?
I really don't have the time to address it, other than to say that it would be unrealistic for us to believe that Mayor DeBlasio, a white man, could or would understand intergenerational trauma and how it impacts Black and brown communities. It would be insane for us to think that he would know that using a government apparatus, apparatus that is not trusted, that is not respected, that the public has no confidence in, to implement a mental health strategy that could be effective. Number one, it's the message and the messenger, wrong. It's the structure you're using, wrong. It's the lack of understanding and the point that where you're starting, wrong. And so while it might be with good intentions, right? You heard the saying, the road to hell is paved with good intentions. So I don't for 1 minute deny that his intention wasn't good. Let's put that to the side. What I am saying is that he doesn't have the understanding and the consciousness to even begin to take into account that he's not addressing what just immediately happened. He's addressing what has happened intergenerationally and systematically. And you're talking about a people who've been traumatized since this country was only 13 colonies before it was even called the United States of America, that have been under attack, that have been under siege, that have been whipped and wounded. So, I mean, if you want to begin to start talking about providing mental health services, you got to first know what it is that you're providing. And so that's all I'm going to say to start off that conversation, because I see heads nodding. So I let y'all take it on home.
You brought us there. We are in the home. We're in the door. Okay, the door is open. I want to address one of the questions before I hand it over to Keith for our last 2 minutes, which someone asked, are we going to address the growing gun violence issue plaguing this city and the part violence interrupters can play with police? Well, Dr. Pryor talked earlier about the violence interrupter programs. And one of the things that I feel like everyone has underscored on this panel is that the resources, the infrastructure, the money is not going there, right? So in order for these of anti-violence organizations and violence interrupter organizations to scale up, the investment has to be made, right? So what role can be played is going to depend on where the resources lie, right? Where the money resides is where you're going to see the biggest impact. And we are talking about shifting that money from where the impact has been more harm than healing and actually bringing it into those systems. I hope that answered that question. And so, Keith, what do you want from us? What do you want from the movement, from the organizations, the coalitions, the elders? What is your call to action in this moment?
I would, most of my time on being here, I'm hearing a lot of centering. And so my call to action would be to center the voice and the demands of the youth. Like, we don't have to use our imagination to solve these problems. We have people actively speaking up and going out and protesting, marching, rallying for the things that we know we lack, we know we've been deprived of. So we can start by significantly reducing NYPD budget and removing them from for example, social services, public institutions, homeless outreach, mental health responses, just generally things that we don't see normally in our communities. We take that money and bring those services to our communities, because again, we've lacked this stuff, these resources for so long, and at some point, when are things going to be just? When are things going to be fair? When are things going to be right for not only the youth, but for our communities, for our schools, for our students? And I would say, listen, support us. That's all. Support us.
Support us. Support us. You know, the safest communities have more services, like you outlined, Keith, and not more police. It's like, look at the data, look at the evidence, right? Like everybody talks about COVID, like look at the science. It's almost as if when it comes to safety, we don't want to look at the science. And we have social sciences, you know, and instead we want to lean into punishment and the carceral system, because we know that it's rooted in white supremacy. We know that it's recruited and maintaining the status quo. And so we have to break up all those things at once. So I understand that Rama is coming back to the stage now to bring us home. This panel has been fire. We know all the things that we need to know, Rama. I don't understand why this isn't just done, why it hasn't been done 5 years ago, 10 years ago. We have the recipe right here. I mean, what is the block? Okay, that's a panel on police unions, but I'll just turn it over to you.
Thank you so much, Munifa. And thank you for that last statement. I think that's definitely true. We've been working on this for many years. We have the data. We know what's the solutions are. We know that it's empowering communities and giving the resources back to community. You know, it just requires bold leadership at the end of the day, right? And that's what we are looking for. Thank you all so much for being here today, for joining us. Munifa, thank you so much for moderating. Dr. Pryor, Adilka, Anush, Peggy, Melissa, Keith, thank you all so much for your insight. And thank you so much for continuing to work with us. And for folks who are watching us, we do have a platform to redefine public safety on our website that touches on several issues that could be, you know, looked at from a different lens, public health lens. So I encourage all folks to go and check out our website. And then this is not over yet. So I want you to also check out the next session led by one of my colleagues on empowering youth towards advocacy. So pretty much a continuation to this conversation. Thank you all so much again, and I appreciate you. Much love.
Thank you.